The Care Quality Commission is in crisis, the Health Secretary Wes Streeting warns after a new report calls for urgent changes. I'm going to read into this more from Sky News, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from Sky News with the headline that the Care Quality Commission is in crisis. The Health Secretary Wes Streeting has warned after a new report calls for urgent changes. The Health Secretary says the Care Quality Commission is not fit for purpose following damning findings from an independent review. Guys, while you're here, make sure you hit the like button and share across social media so others are notified of this video. It's really just this is really once again highlights the damage and the seriousness of issues that we have within our care sector. There are one of a number of factors that are the reason why the care quality that our social health and social care is in such a state it's in. Obviously, the first and foremost is obviously the Conservatives' 14 years of austerity has played a hampering role in terms of rolling back, which means obviously that the quality that people have been getting is not the same as it used to be. It also means that they've expected more people to work more and do less, which means that people have less time on their hands. The money that people were earning before is not the same as it used to be as well. That is also that factor that needs to be played in as well. So people as well, because obviously Brexit also plays a factor into this as well, because obviously we also had people from Europe who used to care and look after some of our people, and that's no longer the case now. Many of them now are from a lot more from abroad, from outside the EU, such as India, from African nations as well, and some of them are either not fully qualified, or some have been qualified and perhaps or therefore documents have not been in place. A lot of things there that's also not played in hand. The difficulty obviously as well, because we've also got less of our own people within the health and social care. Many of them have probably moved on or gone other places, is because of some of these factors that have taken place, which has meant we've also may have a shortage of care quality of people within the system as well. And obviously, if you don't have the highest quality of people when it comes into health and social care, guys, you can find a situation where, as we have seen in some cases here in the UK, some negligently abused people abused negligently by people within the sector who have little to no experience when it comes to looking after others, and some have been treated quite badly by people as well. So to run it in short, this sadly does not surprise me, and this once again highlights how incompetent and how careless the Conservative government was. Now, does this mean that the Labour government are going to be all care bear and making sure that everything's all perfectly all right? I would say only time will tell. Like we said, it's been like 3 weeks, more than roughly a couple of weeks now. It's good 3 weeks, I think, or so now since Labour come into power. It's too early to say, and there's obviously a lot of things to deal with. It won't be for a while before these things get dealt with, but whether or not Wes Streeting will get a grip on it obviously will remain to be seen. So let's read a bit more into this, you guys. So, an independent review into the Care Quality Commission, the CQC, has revealed significant internal failings that are hampering its ability to keep a check on the health and social care institutions. An interim report by Dr. Penny Dash found that CQC's ability to identify poor performances at hospitals, care homes and GP practices have been implemented by its own issues, including low levels of inspections, a lack of clinical expertise among those carrying them out, and a lack of consistency in assessment and IT issues. The report found the watchdog was unable to effectively judge the quality of health and care services, including those in need of urgent improvement. It also said that social care providers were left waiting too long for registration and ratings to be updated, leading to an impact on local capacity. The Health Secretary Wes Streeting, who ordered the report to be published ahead of the full assessment due in the autumn, said he was stunned by the findings and showed that the organisation was not fit for purpose. He added, "I know this will be a worrying development for patients and families who rely on CQC assessments when making choices about their care. I want to reassure them that I'm determined to get a grip this crisis and give people the confidence that the care that they've been receiving has been assessed, and this government will never turn a blind eye to failure. CQC said it accepted the full findings and was working at pace to rebuild trust that had become the strong, credible and effective regulator of health and care service that the public and providers need and deserve. In her report, Dr. Dash received 1 in 5 health and social care providers that had not received a rating from CQC despite its power to assess them. She also said some providers had not been re-inspected in several years, pointing to the oldest rating of a hospital being from 10 years ago and the oldest social care assessment taking place in 2015. Dr. Dash also heard evidence that some inspectors of hospitals had never been to one before, while a social care inspector had never met a person with dementia. What? What are these inspectors doing then? An inspector of a hospital had never been to one before. A social care inspector has never met a person with dementia. What are these? How are these? Why are these inspectors then? What on earth are they doing? Mr. Streeting promised immediate action and increased oversight of the CQC, announcing the appointment of the former Chief Inspector of Hospital, Professor Sir Mike Richards, to review its assessment frameworks. The government has also promised to improve transparency over the watchdog ratings for health and social care providers and ensure the CQC regularly updates the Department of Health on its progress. Meanwhile, Dr. Dash has been asked to review all patient safety organisations for any of those issues. She said the contents of my interim report underscores the urgent need for comprehensive reform within the CQC. By addressing these failings together, we can enhance the regulator's ability to inspect and rate the safety and quality of health and social care services across England. Our ultimate goal is to build a robust, effective regulator that can support and a sustainable and high-performance NHS and social care system with the general public deserve. Say which the general public deserve. Losing my words today. Dr. Dash has called for urgent action from CQC to overhaul its inspection and assessment system as well as fixing its IT systems. The CQC's interim chief executive, Kate Taroney, said, "We accept in full the findings and recommendations in the interim review, which identifies clear areas where improvements is urgently needed. Many of these align with areas that we have prioritized as part of our work to restore trust with the public and providers by listening better, working together and more collaborative and being honest about what we've got wrong. We are working at pace in consultation with our stakeholders to rebuild that trust and become a strong, credible and effective regulator of health and care services that the public and providers need and deserve." Ms. Taroney also said that the organisation had committed to increasing the number of inspections, increasing the number of people working on registrations, and working on a new approach to relationship management that enables a closer and more consistent contact point for providers. But if you've got, why have you got inspectors who've never been to a hospital, or social care inspectors that have never met a person with dementia before? Like, that just screams, that for me screams, what WTF for me? Like, that screams panic. Like, what are they doing? Like, are they actually even, like, are they giving them the appropriate training? Are they being trained properly? Do they know what they're doing? Are they that's incredibly scary. That's incredibly scary, especially especially when you have if you're somebody who has somebody in social care, and these inspectors are not doing their jobs seriously as well. That's really concerning, to say the least. Yes, obviously they say they accept the findings, but you know, I have my questions about Wes Streeting, as I always say on here, guys. But I hope he does a number on the CQC. To ensure that these inspections and these checks are done properly, that these people know what they're doing, because clearly there's something is amiss here. This is a major issue and needs to be dealt with as soon as possible. But what do you guys think? What do you guys make of the Care Quality Commission? What do you guys make of Wes Streeting's comments? What do you guys make of some of these inspectors, a social care inspector who's never even seen a dementia person, or a healthcare inspector who's never been to a hospital? Let me know your thoughts and more about all this in the comment section down below. If you found this video interesting, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video, and subscribe, because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you could do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.